We're hearing that this pledge obviously has been made to the people as part of the election and has been reaffirmed since, but that it's not what's happening on the ground. What's actually happening is the NHS is going through a period of great cost retrenchment at the moment. There is a high-profile pledge or challenge to take 15 to 20 billion pounds out of the NHS, and protected it may be at the national level, but at the local level what this means is that there are vicious cost improvement programmes all over the NHS. So for example, a typical cost improvement programme over the last few years or so might have been about 2 or 3%. That's the amount of money you have to take out of a service, whether it's a directorate or a unit or a hospital, every year. We're now looking at members reporting cost improvement programmes of between 5 and 10% and greater, with the expectation that these will continue for about 4 years or so until we've cut that £20 billion out of the NHS.
Isn't it quite reasonable of the government to expect its consultants to be in the forefront of tightening belts, though?
Well, it would be reasonable if only the government had announced that that's what they were doing, that the NHS wasn't going to be protected, that frontline services weren't going to be protected, that health wasn't going to be privileged. It's a bit of an awkward position to be in, because in a sense we are in this privileged service, but in reality that's not what's happening. However, if there are to be cost reductions, and to a certain extent that's a macro-political thing which has been decided by the government, which the NHS management has decided to move ahead with. If there are to be cost reductions, then consultants, I believe, do have to be at the forefront of deciding how and where services should be provided and delivered. And the reason for that is that a really important part of our job is to be a patient advocate as well as to be a direct carer. And in that, it's not right for us just to sit back and say, well, managers, you've decided on this, you cut what you like and we'll pick up the pieces. We, unfortunately, will not like it, but we have to be in there helping to protect the patient services that are really important.
Are the consultants worried then about the talk of GPs getting the commissioning budget?
I'm not sure I'm worried. The interesting thing about this, and obviously the white paper is coming out in a week or two, we don't really know what's going to be in it. Nobody knows what's going to be in it other than the government special advisors at the moment. It may even be a surprise to some of the ministers, we'll see. It's not so much that it's worrying that GPs will get power in this, it's that we've spent now 19 years searching for a way to make an internal market work. Nobody's discovered how to make an internal market work. Nobody's developed something that will actually stick. The last round of trying to get it to work was to give power to PCTs, the primary care trusts, and the primary care trust demonstrated that they weren't able to do this, which is why, of course, the government, after announcing no top-down reorganisations, has decided on a top-down reorganisation to do away with primary care trust commissioning. It's very contradictory, it's very confusing, but the single thing that's probably most confusing about it is if PCTs are not big enough to negotiate with acute trusts, I don't see how general practices are going to be big enough in their stead. We await with interest, but it's not so much fear as puzzlement as to what on earth is going on.
Are consultants happy for their pay to be frozen for 2 years?
No, I think is the word. Are consultants militant about it? Are they threatening strike action about it? I think also no. I think to say that we're happy would be wrong. I think to say that we accept the inevitability after the recent election and after the formation of the coalition government and after the huge amount of the public's money that's been shoveled into rescuing banks and all of the other things that happened over the last couple of years, I think people accept an inevitability about it. A 2-year pay freeze, perhaps it's not as bad as we could have got. At least it's across the entire public sector. It would be fair if it was across the private sector as well, but obviously there's a privileging of the private sector these days, has been for a while. But I think accepting the inevitability of something is very different to being happy about it or being content.
There's been debate here at conference about the supporting professional activity as part of your contract. How hard are you having to fight to protect a quarter of your contracts for supporting professional activities?
We find ourselves in many places having to fight quite hard. Most of the work that we do around contract and job planning is about educating members, providing members with the tools to be able to effectively help themselves in the job planning process. And actually in most of the country and most of the time that does actually work quite well. There are some high-profile cases where trusts are bearing down upon SPAs and are trying to reduce them in the mistaken belief that it is efficient or productive to stop consultants engaging in quality assurance and quality improvement. It's never so. If you effectively stop those processes of assuring and increasing quality, then gradually your service will become non-competitive, will diminish, and worst of all, it'll become unsatisfactory to the patients who it is actually provided to care for. And getting trusts convinced of the need to keep consultants at the forefront, to keep consultants keeping their services at the forefront of medical care, at the forefront of advances in technology. That's a really important task. We only find we have to do it sometimes in a very strong way, but when we do, we're prepared to do it.
What is the most pressing thing that you would like Andrew Lansley to bring to conference?
There are so many things, aren't there? Which, if I could write the manifesto for a Secretary of State, there are so many things that were in it.
But for your consultants?
Probably the most important thing would be to bring back trust. To bring back trust that consultants are in this job to work for patients, in this job because they seriously care about the quality of service that their patients get, and they don't need the sort of micromanagement that some trusts are putting in because they believe it's more productive to do so. Treating consultants as factory workers does not work. It provides a certain level of assurance perhaps, but it does not get the best out of the most highly trained and skilled medical professionals in the country.